Okay, welcome to one of our next interviews that we're doing at Grace Health and Fitness, interviewing some of the kind of experts in the field of women's health, or at least people with an interest or a passion in that area. And so today we have Kat Monkhouse, who is a women's health physio, and she's going to tell us a little bit about what her job involves and how she ended up in women's health, and just hopefully educate you all a little bit about why you might want to see her one day. But hopefully not, but if you do, why you might see Kat. So I'll just hand over to Kat just now to introduce herself and tell us a little bit about how she's ended up where she is now. So over to you, Kat.
Okay, thanks, Sarah. So yeah, thanks for the lovely introduction. As Sarah said, I am a women's health physio. I started out as a traditional physio. So when I first graduated back in 2006, which is a long time ago now, I was specialised initially more in your sort of normal musculoskeletal, so backs, hips, shoulders, necks, etc. However, after I had my first child, which was 7 years ago, I realised how little I knew. So I think people just assume as a physio that we would have really good knowledge of women's health and postnatal, but actually it wasn't even in my degree. It was an elective module, which I find shocking in hindsight. 50% of the population are women, and women's health, not just in the pregnancy postnatal period, but as throughout life, wasn't even considered worthy of a full module. So my knowledge was just as bad as many other mums. And I realised after having Aaron, I went back to running way too quickly. I went back to HIIT workouts way too quickly. I thought I was kind of invincible. I was 28 and first baby. So I went back to all of those things way too quickly. And as that sort of year or two went on, I found more about women's health physio, and I started to dive into initially the pregnancy and the postnatal period and doing some courses and studying there because it was the most relevant to me at that time. And when I moved back to the UK in 2014, I ended up working in a brilliant clinic in Liverpool with a lady who had a similar story to me. She'd started out as a musculoskeletal physio, had 2 boys of her own, and she'd sort of veered into pelvic health and women's health. So she became a bit of a mentor, and I sort of trained up under her. And as I've gone on over the last sort of 5-6 years, I've started to do more than just pregnancy and postnatal, also helping women in 40s, 50s, 60s, menopause stages, perimenopause and beyond. So yeah, so I love it. I absolutely love it. It's just so rewarding, and it's a great area to work in.
Okay, and are you in the NHS doing it, or are you doing it privately?
No, so at the moment I'm fully private. I just found that worked better around the kids, to be completely honest. So started, I've been in private practice since I moved back to the UK from Singapore in 2014 because it just makes sense, works around the family at the moment.
So, yeah. And Kat now has 3 children.
Yes.
How old was the youngest one? Because I'm trying to think, it was just before lockdown, wasn't it?
Yeah, so she was born 1 week before lockdown on the 16th of March. So she's coming up for 1 next month. And then the older 2 are now 4 and 7. So oldest boy and then 2 little girls. So yeah, same as you. No, you're the other way around.
Yeah, you're busy. And how did you end up being self-employed then and working privately? Is that because of has it been since having the kids, or was there any particular reason that took you into having your own business?
No, so it was really when we lived down in Liverpool for a few years after we'd had our first son, had our second little girl down there when we came back from abroad. And I worked in private practice then because it fitted around the children. And then I'd always sort of thought when I moved permanently home, I would set up for myself and just keep working in private practice. It offers you the most flexibility with the family. And it also, the reason I really like it is it allows me to spend longer with my clients. So I literally schedule a minimum of 45 minutes, usually an hour for each patient, so that I can really hear their story, understand what's going on with them. And actually all my appointments are 60 minutes out, and just really help them, listen to them. And I really think I would struggle now to go back to the pressure of the NHS and trying to fit lots of people in, because I want to be able to give people my time and really hear all of their story and help them as best as I can. So I feel I can do that better in a private setting at the moment. Yeah.
And I think with something like women's health as well,
yes.
You know, I don't know how people can do it quickly,
because
you sometimes might have one thing you're looking at, and then you realize that there's, unless you've got time to ask the questions of a client, even in, I guess, non-women's health work, sometimes unless you get that full picture, you don't always get the right answer for them. So
that's definitely true.
Yeah, so for those who don't know then much about women's health physio, I guess a little bit about, first of all then, some of the kind of things that women might come to you presenting with.
Okay, so yeah, so women's health physio, we would see everyone. So we'd see people during pregnancy. So for example, if they've got pelvic girdle pain or even lower back pain during pregnancy, they would come to women's health physio for that. Also get people in pregnancy looking for advice on pelvic floor exercises, or, you know, are they doing them properly if they're having a bit of leakage, stress urinary incontinence and things. Leakage in general is a big one. So postnatally, that can be a big issue, is a little bit of leakage. And again, perimenopause and menopause stage, that can actually be the first time in a woman's life that they start to experience any problems with like leakage of urine or even feces as well. So you can have fecal incontinence ranges from not being able to control gas, which is a sign of fecal incontinence that people maybe don't even realize is a sign, right through to having sort of leakage of feces. So it can be urinary or it can be fecal. So bowel and bladder health is a huge part of my role. So leakage is probably the most common one at any of those stages that a lot of people present with. Postnatally, it can also be diastasis, so that separation of the tummy, and trying to help women sort of get that back. It's not so much about getting it back together, it's about improving the tension through the gap. So how to improve and rehabilitate if you have that. And people can just feel very weak in the postnatal period and just need some advice as to how to rehabilitate. As I said, for ladies more 40s and 50s, it tends to be more pelvic health issues, so like your leakage. Sometimes constipation is something we can really help with that people might not realise we can help with, and that has a huge impact on pelvic health. And also just general stress and anxiety and things as well play on to pelvic health issues, so we help with that too. So a whole range of things, hysterectomies, pre and post-op as well, and yeah, pelvic organ prolapse surgeries, anything like that, anything sort of gynae, pelvic health. Whole range of
and you're trained as a mummy MOT
yes.
practitioner, or whatever the word would be. And so what is that? If someone's maybe heard me talk about it, because I went for my own mummy MOT a couple of years ago, and shared a little bit about what it involved. But for anyone who missed that, you know, what is that for maybe new mums, or is it for anyone?
Well, yeah, so anyone, I mean, I think the sort of tagline is like from 6 weeks postpartum till 6 years. So really, we would call it a mummy MOT if it was even within that sort of 5-6 years postpartum, because people don't necessarily know about it or come initially postnatal. Sometimes people come like a few years down the line to have things checked out and see what's going on. So mummy MOT, it's just a sort of, you go for training and you're a sort of certified practitioner, but it's not hugely different from any postnatal assessment that you would expect any women's health physio to do. So you go through a functional screen. So you're looking at how people move, because we're looking at hips, backs. We're not just looking only at the pelvic floor. We want to think about how the muscles are working together. So we're looking at global movement. How do you get off a chair? How do you lunge? How do you squat? How do you feel during those movements? Then we're going to look at tummy and see if there's any scars. So like C-section scar, and diastasis, is there a gap and is there a lack of tension through that gap? Scars in the sort of vaginal area as well, vulva area, so there can be episiotomy scars, there can be a tear which hasn't healed up very well or has left a bit of scar tissue down there, so we will look at scar tissue down there as well. And then we'll be checking if they've got any pelvic symptoms such as leakage, heaviness or pressure feeling in the vagina. We'll do an internal, and we want to look at, so an internal examination sounds a bit scary, it's really not. Most people that come postnatally are totally fine with it because they've just had a baby. But sometimes when women come in, maybe they're like 50 and their last baby was when they were 35, they're a bit more, oh, I've been like this for a while. So the first thing I would say about an internal is ideally you would have an internal with a women's health physio, because it gives us so much information about how your pelvic floor is working in terms of strength. Is it able to fully relax as well? It's not just always about strength, it's about relaxation. And is it working in coordination with the other muscles around it? So the coordination of the pelvic floor. So it gives us loads of information, and we can also check for any descent or prolapse as well within the vagina. However, if someone was really uncomfortable, we can work around that. We can palpate bony markers externally, and we can feel what the pelvic floor muscles are doing through external palpation as well. So don't be put off seeing a women's health physio because you think, oh, I'm so uncomfortable with the idea of having an internal. If that was the case, a women's health physio will work around that with you. Yeah, that's really important to highlight, I think. And obviously, as part of that assessment, the first bit that I didn't mention is we take a huge amount of history. So even if you come to see me and you're 50, that example I gave, I'm still going to ask you about your obstetric history, even if it was like 20 years ago, because modes of delivery and all of that can have an impact on symptoms that you're having at sort of that menopausal age as well. And we want to know all about your bowel habits, bladder habits. We will ask you weird questions that no one else will, but that's part of my job. It's talking about the things people don't like to talk about and making people feel comfortable to talk about them. So yeah, that's a big part of it too.
Yeah, absolutely. And I'm all for that. And again, like interviews like this or some of the other avenues you can use, I think, you know, the more that we can just normalize these things. I don't know what the current kind of stats are, but the you know, 1 in 2 or 1 in 3 women with some kind of level of prolapse or urinary incontinence, and you know, I just think it's far too common for us not to happily talk about it.
100%.
So
the other one I would say as well that I forgot to mention is painful sex as well, because that's something that people are embarrassed to talk about. But at the end of the day, it's an important part of your relationship with your partner. And if you're having pain and it's stopping you from having that intimacy, again, that's something that you can come to Women's Health Physio with, and we can help you with. So again, just when you're talking about things that aren't talked about, that's another one that doesn't come up enough, and it is something that we can help with. So yeah,
good. So if someone then comes to you and maybe you talked about what you would do sort of assessment wise, what kind of things can be done for women if they are experiencing some of these symptoms?
So in terms of treatment, it'll be a combination of things. It's very personalized to an individual. So every woman's different. So a lot of the issues might be quite common, like, you know, as you said, up to, I think it is now, they're saying up to 50% of women have some degree of organ descent if they've had a baby, and it's 1 in 5 have some degree of fecal incontinence over 40. So these issues are really, really common, and that's one of the biggest things I think we need to say as well, that it's as Sarah already highlighted, it's so common. But although the issues themselves are common, every woman is completely individual. So the treatment and the assessment's kind of a rough framework, but the treatment will be tailored to what we find and what the woman wants. So you'll tell me what your goals are, and then I'm going to work with you to achieve those goals. But some of the sort of methodology, some of the things we might use like some soft tissue release, some soft tissue work. We can do internal release as well. We might also use acupuncture, can be really good. There's some really good evidence for acupuncture, particularly for menopausal symptoms like hot flashes and things. There's some really good emergent evidence. Actually, it's not even that new evidence, but there's some really good evidence on acupuncture. Things like a lot of what I do will be trying to empower you to help yourself as well. So I'll teach you like things that you can do for yourself. So self-abdominal massage, for example, if you're constipated, that can be a really good one to take away. Giving you the right sort of breath work. So a lot of emphasis on the breath and how that connects to the pelvic floor. And I know you'll talk about that a lot, Sarah, I'm sure. But yeah, we'll look at how you're breathing. I know this isn't new to anyone watching this video, I'm sure. So we look at the breath. And how that affects the pelvic floor. And sometimes it really can be like 1 or 2 sessions. It can be just, I can do palpation and then I can help you with your breath and how to engage your pelvic floor. And honestly, sometimes you can reduce incontinence or get rid of it within literally like a session or 2 sessions. And that sounds a bit like crazy, but it's genuinely true. Like people can see such huge improvements really, really quickly, just with a bit of feedback. So so things like that, breath work, and then obviously rehabilitation. So I will give you personalized exercises that match with your goal. And I won't overload you. I'm not going to send you off with sheets and sheets of exercises. It's going to be very much working with you to find what fits in with your lifestyle and what can you do, what's realistic. We'll also talk about diets as well, dietary advice, hormones. Sometimes it can just be a case of introducing lubrication, can be really important for women. Topical estrogen, or talking about things that you can go back to your GP and discuss, like giving some advice about things that you might want to take back to your GP and talk about. Obviously working with the GP as well, you know, like having a bit of communication there if relevant. If we need to ask for further input, then we will do. So does that give you a bit of an idea or more? That case.
No, definitely. And I think, you're right that sometimes it is just, 1 or 2 things that people just get those pieces of the puzzle sorted. And whether that's diet or whether it's breath or whether it's, I don't know, adapting a certain activity or something, it can be quite straightforward sometimes. And so, it is worth people investigating and seeking some help for it.
Definitely.
So what would you say is your kind of favourite part of your job?
I don't know. It's really, really hard to say. Like, if you, I think it's just when people, I think it is what we were just talking about. Like when it's something really simple, and someone sees such a huge improvement in their symptoms, and they come back and give you that feedback, or just seeing people improve and seeing people grow in confidence as well, and realizing that these issues are treatable and that they've had the confidence to come for it. So yeah, it's just the patient's improvement really is really rewarding. And I think reflecting back to me postnatally and how oblivious I was, like I think just the fact that I have this information to put out there and to help other people not be where I was, completely ignorant of. I didn't even know that I thought prolapse was something that could only happen if you were like 80 plus in a care home. Like, do you know, I genuinely, and I'm a physio, like, and I was so oblivious. Like, so I think just the fact that trying to get get the message out there and the education side of it, I love, and just the individual results that women get. And just one more thing that I want to say that I forgot to mention as well was, if like you come to me and you're a runner but you're having leakage, like I'm very much going to help you to keep running. Or if you want to be able to keep lifting weights, I'm not a physio who's going to say, and I don't believe women's health physios should be saying to people, don't lift anything heavier than your baby, or don't, like, there's the evidence doesn't back up these statements. And I think sometimes the GP or like, when some people can give you like quite damaging messages, like don't move, or if you've got a bit of diastasis, you can't bend over, and then you end up with a whole host of other problems because people are bracing and they're rigid. So very much like your women's health physio, whether it's me or whether it's someone else, they should be working with you towards your goals and ideally making those goals achievable for you. It can need a bit of modification, but it shouldn't be like a blanket, don't do this, don't do that. So that's something that's important to bear in mind as well, and take the fear away from people.
Yeah, well, and I was going to kind of mention the same sort of thing there, as you've just said, for people who maybe feel that they have sought advice before about a particular issue. And sadly, it comes up still far too often where people say, I went to my GP or I went to whoever, and I said, I'm in my 30s and I am leaking, anytime I do anything, cough, sneeze, do my exercise. And it's just been, oh, well, just you've had a baby, that's just that's you now. And it's like, you cannot say that no matter what age we are. You can't just say that. Or on the other side as well, like you say, well, you're going to have to walk, you can do walking for the rest of your life, but you can't do anything harder than that. And it's like, how can you say that? And how can you balance up, the other health benefits we get from doing more vigorous exercise against pelvic floor issues? Because although they are part of our they're part of our whole health, and we have lots of other parts of our body that equally need attention and care, our heart and lungs and whatever else.
And our bone health and everything. And I think as well what you're saying, like, see, for example, strength training, like I know you do a bit of that with your heat, doesn't it? So the heat, like, so that's so important for not just bone health, muscle strength, but like if we look at the global muscles around the pelvic floor, we need to take an orchestral approach. We need to like strengthen the glutes, strengthen the hip rotators. So it's not about just doing these things are so, as you said, it's so beneficial. So don't be scared to move, and if you need some advice, seek some help so that we can make sure that your strategies are good, that you're not holding your breath and putting more pressure down on your pelvic floor. We can help you with the strategies to make sure you're moving well and moving safely, but don't be scared to move. We can help you to move well. And
I always remember Michelle Lyons, and I know you'll know who she is. Like she's a women's health physio, and I always remember her telling us about a research article, and it was showing how much pelvic floor pressure there was from going from sit to stand as opposed to a squat or a lunge or whatever. And I use that sort of story quite a lot with clients, because I think people think I can't exercise, I've got this particular issue, but actually you are putting pressure through your core all the time, just by standing up from your chair, however many times you do that a day. So don't be afraid of exercise, but do still seek some advice. And if you're not happy with, the person you maybe spoke to 5-10 years ago about it, don't let that put you off seeking it again, because I think it takes 100%. A lot for people to feel confident to go in and speak to someone. And if you've then been kind of feel a bit shot down, it does then take quite a lot to go back again, doesn't it? And ask.
Oh, definitely.
Good to hear. So kind of on that note then, my kind of final question with you is, if you had a message for women listening, and there'll be women at all different stages who will listen to this, I'm sure. So what would be your kind of one message you'd like to give out to women?
we've kind of covered it to us, but it's don't put up with it. So like, just don't think that you have to live with it. So it can be whatever. It can be primarily the one that I think most commonly would be the leakage, because it's such a common issue in women at all ages and stages to have some degree of primarily bladder leakage. But as we said, up to 1 in 5 can have some fecal incontinence post 40. So it's huge. And I think the whole media perception of like 10 a lady and just pop a pad on and everything, it's just so wrong. It's so wrong. So I think that's my thing, is like, just don't put up with symptoms. Like if you've got pelvic floor symptoms, pelvic health symptoms, just get some help. There's people out there that can help you. And just, you know, Sarah's doing great work already with all the education she's been at and all the exercises that you guys are doing through Grace Health Club. But, you know, if you need a bit more investigation, come and see me, or come and see another women's health physio. It doesn't have to be me. Go back to your GP, you know, get the input that you need. Definitely don't ignore it and don't live with it. We can help. We can help.
Exactly. And I totally agree as well. And I think that is important to just keep reminding people. And like when I spoke to Sam the other day, we were talking about I don't know I can't remember what her message was, but we ended up at the same kind of point as what I'm thinking now. And it was just that, you know, you deserve to get seen with whatever is giving you bother. You know, I think we do often put ourselves bottom of the list of priorities when we've maybe got family to care for, or you know, work's busy or whatever. So, you know, take that time for yourself. And, you know, it doesn't need to be a long drawn out process. You know, just take that time, give yourself that wee bit of time, and, you know, give yourself then years hopefully of not experiencing the same
100%. And as I said, it can be like 1 or 2 sessions. That could be all you need. Literally, it can just be like coming in for a couple of sessions, and that can be enough. And I think, as you said, like women they put themselves last, and they think, oh, I'll just put up with this, I'm too busy looking after everyone else. So that's a really good point. And that's one of the nice things about the mummy MOT, actually. It's making mum in the postnatal period take a little bit of time out to focus on themselves, which is really important. So yeah, I think we're all singing from like the same hymn sheet, aren't we? Like Sam, everyone, we're all
and you want to say to people as well, like don't leave anything, you know, don't leave it until it maybe gets worse, but also it's never too late to do something about it. Do you know, so both ends, you know, do something as early as you can, but don't feel, oh well, I'm now whatever age, or, you know, there's nothing that can be done for me now. You know, that's not true.
That's something I hear actually as well, like, you know, from women who are maybe 50s, 60s, they think, oh, I just got to live with it. And you don't put up with it. That's my take thing, is just don't live with this. Don't put up with symptoms. Come and get help.
I agree. Good. Well, any last words from you at all, Kat?
I think we've covered it all, actually. I think we've talked about most of the things I wanted to highlight. So yeah, thank you very much. Thanks for having me on.
Yeah, thanks for your time. And we'll pop Kat's details below our video, just so that you can contact her if you're local to her. But equally, I can maybe give you, we can find a list of people if you're a bit further afield that you would contact. And yeah, all that's left for me to say is thank you for your time. And thank you for watching, wherever and whenever you watch this or listen to this. And I look forward to sharing another story and interview with you in the coming weeks and months. And if you have any questions as well for me or for Kat, then please just pop them in comments or send us a wee message, and we would love to get back to you on those. So bye-bye from me just now, and I'll see you all again very soon. Bye.